Thank you for your time today to hear the first of our brief overviews of the Health and Care Staffing Scotland Act 2019 that will come into enforcement on the 1st of April 2024. In this quick overview, I will talk you through the 4 parts to the Act, as well as look at Part 1 of the Act and what this means for children and young people's services. This is the first legislation in the UK to set out requirements for both health and care services and will affect legislation that guides the requirements of services you currently provide. And I will go further into this in my second video. There are 4 parts to the Act which you can see on the screen. Part 1 affects the work of all services registered with the Care Inspectorate. These are the guiding principles which I will cover in this presentation. Part 2 is only applicable to services in the NHS, and therefore these do not apply to children and young people's services. Part 3 is applicable to care services and relates back to the guiding principles of Part 1. There are also other elements to Part 3 that I will highlight to you in my second video. Chapter 3A is only applicable to care home services for adults, and this is not something that will be part of these short presentations. And finally, Part 4 is a short part of the Act. It provides the short name for the provision of the commencement of the Act, so there's nothing written into this part that holds any expectations from services. So which part of the Act applies to your organisations and services? So we can see here that you only need to be thinking about and concentrating on Part 1 and 3 in terms of enactment for children and young people. Before I move on to focus on Part 1, I just want to quickly visit what is meant by a care service, and specifically what care services this applies to for children and young people. And the reason that I do that is because it is written into the Act itself. So a care service is defined in the Health and Care Staffing Scotland Act 2019 as a service mentioned in Section 47 of the Public Services Reform Scotland Act of 2010. And you can see here the full list of services the 2010 Act covers. This includes ELC, adults, as well as children and young people. In terms of children and young people's services, these are the services highlighted that I'm concentrating on as the Safe Staffing Advisor Lead for children and young people across Scotland. So back to the Health and Care Staffing Scotland Act. Part 1 of the Act tells us the guiding principles for health and care staffing, and these apply to all social care services. Part 1A of the Act states that the main purposes of staffing for healthcare and care services are to provide safe and high quality services and to ensure the best care outcomes for people who use those services. So the rest of the Act is about making these main purposes happen. Moving forward, services should be able to demonstrate in their own way how they've considered the guiding principles and used them when making decisions about staffing. So with Part 1A setting out the overall guiding principles, Part 1B goes further and sets out 8 main principles that you can see on the screen. The Act states that these 8 principles must be considered when arranging staffing in any service type, and that's in order to achieve the overall guiding principles of the Act that we just reviewed in the last slide. To begin to break these principles down individually, the health and social care standards support the first principle of improving standards and outcomes for children and young people experiencing care. The second principle of taking account of individual needs, again, is something many services do very well, and that's through things like assessment, care planning and reviewing. The United Nations Convention on the Rights of the Child support the third principle of respecting the dignity and rights of children and young people. And I could go on, as I'm sure you're able to identify many areas of good practice in your own service in some or all of these guiding principles. The addition to current legislation is number 5, which is highlighted here, and this is the well-being of staff. Your organisation may already have measures in place to consider staff well-being. You might visit staff well-being in supervisions or offer peer supervisions, or have access of support for your staff outside of work, such as an employee assistance programme. The well-being of staff and the outcomes for service users are interlinked, and it is important to recognise and establish support for our staff that complements the work they perform in caring for children and supporting children and young people. This was a brief overview of Part 1 of the Act. Thank you for watching.